Welcome to Target Success. Our weekly cable television program brings us guests from the fields of business, education, government, and economic development. Today we have as guests from Mount St. Mary's Center for Women, Dr. Sharmeel Thota and Dr. Rachel Westlake. Welcome, ladies.
Thank you.
Actually, I should say welcome, doctors. It really is a pleasure to have you. The Center for Women has now progressed. It's in, Dr. Westlake, second year?
Yes.
Yeah, it's in its second year.
It's in its second year.
Yes.
You're certainly not in your second year,
No.
Dr. Rachel Westlake. Tell us a little bit, you're a specialist in OB, and tell us a little bit about that, about your background.
Well, I started off, I did medical school at the Royal College of Surgeons in Dublin, Ireland, and that was a 6-year program. So I did 3 years of clinical work and 3 years of book work, and then I did a year of interning there. And then I applied for residency here in Buffalo, and I got into Women and Children's Hospital right here in Buffalo, and I stuck around, and I started working at Mount St. Mary's back in 2009. So it's been a pleasure. It's been quite a wild ride, but very, very fun.
Then, Dr. Westlake, you've seen the beginnings and the start of the Center for Women, which we're going to talk in depth about today, but that is really a great new facility at Mount St. Mary's.
Absolutely. A lot of work, foresight, and money actually has gone into the progress of the second floor at Mount St. Mary's. You know, people have spent quite a bit of time trying to anticipate the patient's needs and also to cater to a well population, a population that comes in for preventative care as opposed to just sick visits. And that, I think, is the beauty of the floor.
Dr. Sharmeel Thota, OBGYN from India. I would like to know a little bit more about your background for our listening audience.
Yeah, I did my medical school in India, Bangalore, India. It was 5 years course of medical school. I finished over there and then applied for residency. And then I got into residency at Bronx Lebanon Hospital, New York. I think one of the best places to get trained. So I did my 3 years of residency over there, and then I started working at Mount St. Mary's Hospital.
That must have been some experience coming from such a big city, New York City, and a huge hospital. Not that Mount St. Mary's is a small hospital, but it's a little better to get acquainted to, I would imagine.
Yeah.
That's been some experience for you, though.
Yeah, definitely. I mean, getting trained at Bronx Lebanon Hospital was like, it's like if I open an OBGYN book, every case that we read over there, it was more like doing practicals. So after getting trained over there, working at any other place would be much easier. It keeps us on our toes. We have seen so much, so we know what to anticipate. Gives us a lot of experience, and it's good.
Well, that's good. That's good. $2 million for the new center at Mount St. Mary's Hospital, OB, GYN, labor and delivery, women's surgery, all in a renovated, very safe and convenient location on the second floor. Kind of interesting to bring all that together for a first time. What have women's expectations been now that they have this new facility? Because it certainly is different from when it was 10 years ago.
I think actually our patients are pleasantly surprised in that they walk in, you know, whether they are pregnant or whether they're just coming in for a GYN visit, they come in and they're pleasantly surprised because they feel like the setting is very calm, it's very receptive, it's very friendly, and they do their visit in, you know, much like you said, very clean and updated site. And then the beauty is they don't have to go that far to, you know, deliver their baby, or if they're waiting to be seen and we have a delivery to do, it's very convenient. We walk, 10 yards down and we have the labor and delivery. We can manage both inpatients and outpatients. It's convenient for us in that we don't have to run from one location to another. And it gives us it gives patients a comprehensive feel because they don't feel like they have to do a lot of running around when it comes to managing their health care and managing their pregnancy. So I think they've been pleasantly surprised. I think because of the way things were set up in the past, there's an expectation that there's going to be long waits and there's going to be big breaks when we have to do deliveries. But that hasn't been the case, which is a pleasant surprise.
Dr. Thoda, you're not alone, the two of you. You have some other people working with you. Let's talk about that. You have another doctor, you have two part-time providers, you have a nurse practitioner. Tell us a little bit about that.
Apart from Dr. Westlak and me, there's Dr. Tushan, who is a full-time OBGYN. Then we have Andrea Rosati. I think the whole community knows her. They really love her for what she's doing. Then we have Dr. Weissman. He's excellent physician, and Dr. Weslowski. I think when you say Dr. Weslowski, they know her. The patients just love her. They come back only to see her, and she's doing part-time, but patients are more than happy that she is back and working with us.
So I think two of the neat things about the Women's Center is transportation. You can get picked up in transportation because of the hospital MSN Van Gogh service, the Mount St. Mary's Van Gogh service. Plus, you can get same-day appointments. I think that's another star for the Women's Center, correct?
Yep.
Absolutely.
One thing the patients liked is they come for the visit and then they say can we get a mammogram today? We say absolutely. There should be no reason why we cannot get you a mammogram or a bone scan or a sonogram not done on the same day. So they come for the visit, everything is done on the same day within 30 minutes or something like that, and they go home and they know exactly what's happening with their health, how the follow-up is, and they get a complete picture of it. So that's the beauty of it. They come, everything is done on the same day, easy to get in. So they feel really happy about it.
That of course is very, very important. It seems to me that because of those current procedures, someone is able to get back with their family, maybe even who's still working, and not have prolonged time spent coming and going to the hospital.
Exactly.
Yeah, absolutely.
Well, that really makes sense. Let's talk about robotic surgery. Tell us about that. How has that helped? Because you talk about Dr. Weissman is one of the most skilled robotic surgeons in Niagara County. Tell us about that.
It's actually been a unique experience for us in that we've been able to get involved with Sisters Hospital and get connected with the robotic privileges over there. And both Dr. Tushan and Dr. Weissman have been working hard at collaborating with Sisters Hospital to do robotic surgery there. So the two of them are actually very involved in that process. Dr. Tushan started to do robotic surgeries starting in April, and he's slowly building that component. Dr. Thoda and I do the minimally invasive component. Both robotic and laparoscopic procedures are under the minimally invasive surgery category. So they both have shorter hospital stay, shorter recovery, and the least amount of cost. And so that's why there's a push towards that type of surgery, because patients do better and the hospital does better with those type of procedures. And that is where our focus is. Our focus is in being more adequately prepared for those kind of things, and also to be more properly trained for that type of surgery.
I know imaging of the baby before they're born in 4D is ultrasonic is just special. that's a service too now, Dr. Thoda, that is very easy, and they're able to sort of see the development.
Yeah. Thing is, I mean, we do sonograms on all pregnant ladies. Like, there are 3 main sonograms that we do: one for dating, one to screen for any anomalies, and the other one may be a growth scan. The 4D sonogram is more like, pregnancy is a beautiful thing. It's something you enjoy, and it gives you smile. And when you see the baby's picture in a 3D picture, it gives you more joy. Like, so we want this whole experience to be a beautiful one. It's not like a medically required one that we're doing, the 3D scan, but it's something that we want to bring joy to our patients. And the best thing is we do it for free. We don't charge the patients for that. And it's nice to see smiles on our patients' faces when they see the baby's pictures.
Now, you also certainly are involved in mammograms, and you encourage, certainly, I know that now it's something that's encouraged ladies at an much earlier age to have, and those mammograms are provided. I know that, let's say, a past person who I worked with came specially when that was developed at Mount St. Mary's, because that was not available in all places. And I think that's another plus for Mount St. Mary's Hospital. But tell us about that.
Well, I think, you know, going off of the bat of what Dr. Thoda said, I think the beauty is that, yeah, there's the digital mammography, and also the radiologist right on site, and the patient has a capacity to come in, see us, get their annual done, grab their script. Our staff even schedule their appointment, and knowing that they're coming in for their annual, they actually get preferential treatment to come down and get an appointment right away. And a lot of my patients, after they've seen me, I've asked them, are you going to go get your mammogram done? They said, yeah, I'm running down there right now to get it done. And that, I think, is really nice, because the convenience of the location, the capacity for the radiologist to call up and let me know if there's a problem. I can call down and ask for specific things to be done if there's a complaint on a breast exam. That kind of communication between physicians, and also the convenience of the location, and the upgraded equipment and the new imaging technology, I think makes it a superior place to come to have your care done.
Now, I might add, besides all those advantages, we are able to have a person drive up in their car and have the car taken and parked for them, especially with certainly a lady who's coming in, who's expecting. She doesn't have to worry about where she's parking, and can get right in and go right up to the second floor. So it's another distinct advantage, having valet parking.
Absolutely, absolutely.
I guess you really have to offer all these services to make sure that they are getting top-notch care. You service patients, you service women, ladies from all over the area, whether it's Grand Island, whether it's Lewiston, at parts of Niagara County, even for that matter Tonawanda and certainly North Tonawanda. You are open for that, and that gives it a nice picture that they are able to come and get that type of service and get it fairly quickly. Does it take a long time to get appointments and
No.
sort of get into that, Dr. Thoda?
No, it doesn't take long. Like, I mean, you call, and if you say like you want to see the physician today, there's no, I don't think we have declined any patient visits like that, or we will decline. If you say like, look, you want to see the physician today, we will accommodate you. So getting appointments is not that difficult at all.
So let's talk about this. With the center, you're also linked for the good health of certainly of your patients to all the services at Mount St. Mary's Hospital. I think that's another distinct advantage. It's not like they have to go someplace else for some type of treatment in a different category. Tell us about that, Dr. Westlake.
I think it's nice that we have, you know, general surgery very close by to get, you know, consultations. We have infectious diseases, we have primary care, we have lab work, we have, you know, like I said previously, the radiology department, and all these things afford us a capacity that if we find something that we were not suspecting, or we find, or the patient tells us something that is not a GYN complaint, we have a capacity to be able to refer them to all these different specialties and subspecialties to be able to manage their care, and manage their care in a very cohesive, continuous manner, not to send them, you know, out into another office, another building, wait for the consult letter to come back in and then call and talk to the patient, but direct communication with every single department. And I find that the more we're communicating with each different department, the better the care gets for the patient. So we've actually taken a very active role calling, you know, everybody, letting them know that there's a particular patient coming down and where, you know, we need a specific test or we are looking for a specific thing, and the patient gets a more concise, you know, tailored medical treatment.
Now that you've been functioning for approximately 2 years, I know I want to talk about the suite in a minute, but I'm thinking ahead. Are there improvements already that are being thought about to even enlarge or do something more with the rooms on the floor?
Oh, absolutely. Our practice has actually doubled in the last year, and so for us, we're definitely looking into plans to increase, you know, patient exam rooms on the outpatient component. There's still work that's being done on the inpatient component. We are, you know, still working through some of the labor and delivery suites, and you know, there's always potential for and room for growth. And I think that's the nice thing about Mount St. Mary's. They don't put that aside and say, well, now we've arrived. They're always looking for a way to grow and to change and to improve, you know, improve the hospital. And I think the second floor is no different from that. They have that mentality.
Dr. Thota, tell us about the new labor and delivery suite, which I know when I saw we actually did some taping, I think, when we did this program back over a year and a half ago, when it was just being ready to be open. And I can remember how very attractive the new bed, the shower, all the things that went with that to make a family comfortable during this delivery and labor. Tell us about that.
If I have to go to a place to deliver, I think that would be my choice, because more than anything else, it's beautiful. People the minute they enter, most of the reactions are like, is this like the labor and delivery room? Because it's so beautiful. It has everything that they require is right over there. And it's more like a spa experience for them. And that's what we wanted, and the patients are very happy about it. And like I said, it's really beautiful.
Now you mentioned this, that the doctors have offices there. That also is not usual in a hospital. The connection between the patient, the doctor, and the actual hospital and the center. Tell us a little bit about that, Dr. Westlake.
Again, I think it goes back to that convenience, you know, that convenience model. And also, I think when putting the offices right on the floor, they were thinking of us as physicians, of how difficult it can be when we have patients scheduled all morning and a patient comes in labor. How do you manage two different components of your practice? And so with that regard, that office being right on the floor, everybody knows where to find us. They know that even if I'm on call and Dr. Thota happens to be there, she'll pick up, you know, and she'll help with the delivery. She can help me manage my load. And I think that is what is nice about that office being right on that floor is that we can manage our outpatients as well as the labor and delivery patients all at the same time with very little inconvenience or wait time for our outpatients, which is a big concern for a lot of patients when they come in to see their GYN.
Dr. Thoda, it seems to me that I know I've spoken with Fred Queso a number of times, and he's always asking me to emphasize sometimes the classes. And it seems to me that at Mount St. Mary's Hospital, especially now connected to the Women's Center, that giving birth is just the beginning of starting a family, and family education is very, very important. And through the center and the facilities at the hospital, a number of classes are offered.
Exactly. If you actually go onto the website, every month they actually post what time and when the classes will be held. It's not only, it's for the parents who are the expecting mothers, their grandparents, how to take care of the grandchildren, the brother and sister classes, smoking cessation, elderly education about breast cancer awareness. I mean, a lot of educational programs are being conducted every month. So people will be well informed. At least they will know what to expect. What they need to do.
Now, we need to talk about the suite again a little more, because that's the first. There's going to be 2 more, I believe,
Exactly.
as time goes on and the work is completed, plus the renovation of the private rooms also
Yes.
for overnight. Tell us about that.
So currently, our current labor and delivery suite is very spacious. The whole thing has been, the entire space has been renovated. Brand new showering facilities. The bathrooms are all very, like Dr. Thoda had mentioned, spa-like. The convenience of having all the equipment right in the room without making it look very technical or
Antiseptic.
exactly medical. So a lot of people come in with this expectation that it's going to be a hospital, and the beauty of our practice is that obstetrics is usually healthy women, and they come in for, like Dr. Thoda was mentioning, a positive experience. And I feel like the aesthetics of the place give you that comfort, that care, that you're being primed, as opposed to coming in just to deliver a baby from a medical component. And there's 2 more rooms that they're working on plans in a similar fashion. And also we have 10 inpatient rooms that are being, like you were saying, constructed to be a private style. So the own bathrooms, their own personal room, and baby and mother together as much as the mother wants or is able for.
And the family could stay overnight with
Exactly. With them.
Absolutely.
which is very, very nice. And again, it goes to that quote family atmosphere and
Absolutely.
The best thing about this practice is, like, I would say, mainly the pregnant women, we see them very often when compared to other women whom we see like once a year or depending upon what the cause is. But with pregnant women, we tend to see them more often. We tend to form a relationship and nice bonding and all that. The best part is after the delivery, they're very happy that the experience was really good, but one thing they say is like, I'm going to miss this place, because it's not going to be that often. Once they have the baby, then we'll see them maybe once a year or depending upon the need, but it's not going to be very often. And they look at us and they say like, I don't know what to do because I'm going to miss this place. I'm so used to coming to this place. Now I'm not going to, visiting that often. And that really makes us feel happy that we did a good job.
I would think that good job brings word of mouth
Exactly.
to other people in the same age, same friendships, same families, that they recommend to come to Mount St. Mary's Hospital for this family experience.
Absolutely.
Yeah, I think that's truly wonderful. We have a few minutes left. What would you say might be something you would like to see in even an improvement, in addition to what's already taking place? What might be something that would even make it work better?
Gosh,
It's a difficult-
yeah, it's
that's
a
a
very
difficult
tough
question.
question because I feel like there has been a lot of components that even I would not have imagined that Mount St. Mary's has to offer. And
I mean, it's a teamwork. I mean, it's just not the physicians. It's like a teamwork, taking care of patient. It's the physicians, it's the nurses, it's the administration. It's right now it's going really well. Like it's going really beautifully. I think the only thing we can hope is we just want to do what we are doing, continue what we are doing. We want to be the providers who will listen to the patients, who will understand them, and put ourselves in their place when they come to us and try to help them. We just want to continue like that. I think that's all I would wish for, because there's not a single thing that we cannot provide. Starting from 13 years till whatever age, different problems, let it be pregnancy, let it be gynecological problem, urinary incontinence, malignancies, any problem you name it, we are able to handle it. So we just want to continue the good work that we are doing, and the administration support us like the way they're doing now.
And I'm sure that people who are interested in wanting this service to continue and improve and get better, and would love to be able to donate funds, and I certainly would love them to contact the foundation at Mount St. Mary's Hospital. I have a little bit of a link there with my daughter, certainly Lynn Catalano, and they could just apply and send checks or ask how they could help fund some new procedures or new facilities at the Women's Center. So
That would really
absolutely.
help us.
I want to thank both of you for being here today to discuss the Center for Women at Mount St. Mary's Hospital. I think it's an exceptional development and program, and we certainly will look forward to having you come back maybe in a year and tell us about more improvements and more successes at the hospital. I want to thank you both for being here.
Well, thank you
Thank you
for
so
having
much.
us.
I want to thank our listening audience for tuning in again to our program, where we had as guests Dr. Sharmali Thota and Dr. Rachel Westlak, both OB/GYN at Mount St. Mary's Hospital, discussing the Center for Women. Thank you very much for tuning in, and look forward to seeing you again soon on Target Success.